Hi HNN313 team, my name is Nicole and this is my video presentation for AT1. So a perioperative nurse plays a crucial role in ensuring a patient's safety before, during, and after the surgery to minimize potential risks for the patient. Evidence shows that the more the patient is prepared before the procedure, the less likely he or she is to have the surgery canceled and has better post-operative outcomes. So when preparing a patient for day surgery, the nurse mitigates these risks in many ways. The first is by 1. Performing a comprehensive preoperative assessment of their physical well-being and their comorbidities. This determines the patient's appropriateness for the surgery, their level of risk when undergoing surgical procedure, and determines the need for any additional diagnostic testing they may need. Performing a comprehensive physical assessment has the greatest effect on reducing adverse complications during and after the surgery. The second is to perform an assessment of the patient's understanding of the surgical procedure and process as well as their patient preferences. This helps to identify any gaps of knowledge they may have and can help the nurse know what education to give. Discussing patient preferences, i.e. with anesthetics, involves patients in their treatment and facilitates shared decision making, which empowers the patient. Assessing patient preferences can also help the nurse advocate for the patient throughout their care. The third is an assessment of their post-op support. So is there someone there who's available to transport the patient home safely and remain with them 24 hours after the surgery, or will they have to stay overnight? And the rationale for this is to ensure that the patient will be in a safe environment where someone can help monitor them post-op. It prevents a longer stay in the hospital and prevents the cancellation of the surgery. The next point of care for the nurse to do is to provide patient education. So in preparation for the surgery, the patient must be instructed to 1. Fast, and the rationale for this is so that the stomach must be empty to prevent aspiration. This reduces respiratory complications during the surgery and reduces the risk of death or increased length of stay. The next point of education is to bathe with an antiseptic solution the night before or the morning of the surgery. This reduces hospital-acquired infections, which reduces the length of stay. And also, the patient should halt the use of any medications that could increase surgical complications. And also, they should stop smoking 12 hours before the surgery. This reduces any complications during and post-surgery and leads to better healing. The nurse should also educate the patient on information about the surgery and answer any questions that they may have. So they should familiarize the patient with procedures, anesthetics, surgical routine, post-op expectations. This gives the patient a sense of control, decreases their fear, vulnerability, anxiety, and pain, and their length of stay. This helps improve the patient's confidence and experience, leading to better patient outcomes. The next point of care is for the nurse to complete the surgical tasks, such as the pre-op checklist. So this confirms the correct patient, the current procedure, fasting status, and alerts. This increases patient safety, as surgical safety checklists are associated with an increased detection of potential safety hazards, decreased surgical complications, and improved communication among operating room staff. And the last point of care is to provide a detailed and concise handover to the receiving nurse, as handovers are critical to patient safety. According to Eggins and Slade, ineffective handover is actually responsible for 25% to 40% of adverse events in the hospital. So the rationale for this concise and detailed handover is to reduce errors, inappropriate treatment, adverse events, and ensures safe, quality, and effective continuity of care. Thank you.